The Department of Health warns the public to be mindful of the severe diseases from floodwater as the agency gives tips to avoid typhoon season diseases. Aiko Miguel will tell us why.
The Department of Health has raised a code white alert in anticipation of disease outbreaks in areas affected by Typhoon Ompong. The potential super typhoon is expected to cause flooding. In such situations, the DOH advises parents to monitor their children and bar them from playing, wading, or swimming in floodwater where water-borne diseases breed. Health Undersecretary Eric Domingo explained that aside from leptospirosis, there are other diseases that people can acquire from exposure to rain and floodwater, starting with the most common fever and flu, followed by dengue, typhoid fever, and cholera. The health official added that floodwater is obviously contaminated with bacteria and viruses that can be harmful and fatal once they enter the human body.
Ito pakiusap namin sa mga magulang, kasi po pag talaga nagtampisaw ang bata sa tubig na marumi, lahat ng sakit nandun na, merong bakterya, merong fungus, merong virus katulad ng leptospirosis,
Different kinds of pollutants are also contained in floodwater, especially in areas near canals, lavatory, and sewerage system.
Hindi natin alam kung saan ang galing yung tubig na yan, na kasama na po yung dumi galing sa imbornal, kasama na po yung dumi sa kalye, at pag nainom pa siyempre ng bata ito habang nagsiswimming siya at naglalaro doon, papasok pa sa katawan niya. So napakarami pong sakit na makukuha sa maruming tubig at hindi po dapat ito gawing laruan ng mga bata.
It is most dangerous when a child drinks floodwater, which causes diarrhea and worse, cholera. The health official advises households to always store clean water, especially during the onset of a typhoon, for domestic use and more importantly, for drinking.
Siyempre yung water supply natin, maaring makontaminate yung pinagkukuha ng tubig, lalo na yung mga gagamitin natin na iinumin or gagamitin sa pantimpla bawa ng mga papainom sa mga bata. Common din itong mga sakit na gastroenteritis, yung mga nakukuha sa contaminated na tubig katulad ng hepatitis, at may mga mas grabe pa, katulad ng typhoid at saka yung cholera.
The DOH reminds the public to immediately bring to the nearest hospital or health center anyone who is experiencing severe diarrhea or loose bowel movements of up to 4 times a day to prevent dehydration. The agency has secured enough supply of oral rehydration solution in rural health units nationwide. Meanwhile, the Department of Health is monitoring possible disease outbreaks in areas which will be badly affected by Typhoon Ompong. As a measure, the DOH has prepositioned medical supplies and equipment amounting to 19 million pesos in different health facilities in the concerned regions. DOH has also set 40 million pesos as a quick response fund once Ompong severely hits regions, especially northern Luzon. Aiko Miguel, UNTV News and Rescue, Manila.